Hi, my name's Jenny and I'm doing my presentation on hypothyroidism. First, I'd like to demonstrate how the thyroid works. So your thyroid is a butterfly-shaped gland that's found on the anterior portion of the neck. It is part of your endocrine system, so it can't be separated from the rest of your body as everything is connected, so it must be treated as such. Your pituitary gland releases TSH, or thyroid-stimulating hormone, which then communicates with your thyroid to create T4, which is then converted to T3, which is the active hormone in the liver, the kidney, gut, as well as other tissues. The conversion of T4 to T3, however, is dependent on the presence of iodine, selenium, and tyrosine. So what does hypothyroid mean and what might it look like? So hypo, meaning your thyroid is underactive and not producing enough thyroid hormone to keep your body running the way it should as it affects your metabolism. So the most common form of this is shown as an autoimmune disease affecting women more than men called Hashimoto's, but not all hypothyroid disorders are autoimmune. So some symptoms may look like fatigue, weight gain, puffy face or moon face, cold intolerance, decreased sweating, heavy or irregular menstrual periods, impaired fertility, depression, lower heart rate, among other things. You don't need all the symptoms, however. If you are presenting with some symptoms, you can send for more tests to be sure, and you can also do a few tests at home, which I will tell you about later. So what might be causing this? So low levels of iodine, as it is needed for the conversion of T4 to T3, and it is not created in the human body. So this could be caused through shifts in eating patterns, like getting away from our standard American diet, going on a bit of a healthier path. Like I said, autoimmune, so Hashimoto's, which makes up 90%, and insulin resistance, elevated estrogen, liver dysfunction, digestive problems, chronic stress, chronic inflammation, especially in the thyroid or thyroiditis, environmental toxins such as mercury or overexposure to bromide from hot tubs, surgery or radiation, maybe it's on the thyroid or the thyroid has been removed, overconsumption of raw cruciferous vegetables, nutrient deficiencies such as zinc, copper, vitamin A, B2, B3, B6, and C, congenital hypothyroidism, which is present at birth, as well as some medications like our corticosteroids. We want to do testing to be sure, though. So certain ways to test. The Western medicine approach is a TSH test or blood test, sorry. They'll give you a score. If it's a high score, you'll be given a synthetic T4 hormone to complete the job that is not being done within your body. So the basal body temperature chart is another tool that we can use. So immediately upon waking up, you're going to put a thermometer into your armpit for 10 minutes. You're going to lie there. You're not going to do anything else. You're going to take the reading every morning for 5 consecutive mornings. You want to be between 36.6 and 36.8 degrees Celsius. An average below 36.6 suggests hypothyroidism, although it is not a diagnostic tool since liver, adrenals, and lungs and things like that can change our body temperature. A simple test for iodine deficiency is painted a 2-inch diameter on some sensitive skin or some soft skin, like your inner arm or inner thighs, of an iodine tincture, which you can get at your local pharmacy. If there is a deficiency, the patch will disappear in less than 2 hours, sometimes as quickly as 20 minutes. If it fades in 2 to 4 hours, levels are only a little below normal. If it persists for more than 4, your iodine is likely sufficient. The Western medicine tests, sometimes levels can look normal. The problem is in the conversion from the T4 to T3. So it's best to use all these tools together to give you a better idea. Some foods to avoid are raw brassicas, kale, chard, spinach, mustard greens, broccoli, Brussels sprouts, cabbage. We can't cook them. Cooking them is fine. Our soy or factory farm meats are loaded with hormones. We want to limit our carbs if we have an insulin resistance. And we want to not heat up any of our foods in plastic, which is true for anything, not just hypothyroidism. Some foods to consider are seaweeds or sea vegetables, so our kelp and our bladderwrack. Brazil nuts, 1 to 2 daily, just is all we need for our selenium. So if we do with Hashimoto's, we do want to consider leaky gut. So we do want to focus on a potential intolerance to gluten and dairy. So some herb and nutrient considerations. So our adaptogens to support our HPO access and endocrine health and support. Ashwagandha, eleuthero, ginseng, reishi. If there is potential mercury contamination, we could use allium and rumex. Immunomodulators to support our immune system like astragalus, turkey tail, reishi, vitamin D3, but we do want to avoid immune system stimulants like echinacea if it is autoimmune. Our hepatics for our liver function, as that's where a lot of the conversion happens. Milk thistle, dandelion are bitters there. So our circulatory stimulants to warm things up, so our ginger, our cayenne, our rosemary, all our favorites. Some herbs for leaky gut to help with digestion. Like I said, it is the conversion of T4 to T3 is done in the gut as well. So fennel, chamomile, and ginger. With leaky gut, you do want to avoid our food allergens, like I stated before, alcohol especially. Some other herbs we can consider are Smithsophuga, iris, verbena, smilex, panax, ginkgo, avena, as well as many others. So a reminder that treatment for thyroid function can take up to 2 weeks for changes to appear. You are treating the entire system. And as with most ailments, stress reduction is key as we want to allow the body time to heal itself.